Hello, everyone, and welcome to this audio podcast. This audio podcast as part of the Interlobular branch edition. This audio podcast as part of a Storm Communicade. This audio podcast as part of a Squadron G-Force. And this audio podcast as part of a Storm Logistics production. Uh, in this audio podcast, a little bit around HSP and the sort of the biomedical and the clinical anatomy practice aspects. So results of some routine laboratory investigations remain within the normal sort of laboratory reference ranges. A normal platelet count rules out idiopathic or sort of unknown thrombocytopenic purpura. A normal platelet count and normal coagulation study results rule out thrombocytopenic purpura. A normal lipase level makes acute pancreatitis unlikely. Anti-nuclear factor testing or investigation, serum immunoelectrophoresis, anti-neutrophil cytoplasm antibody testing, complement C3 and C4 testing, and genetic typing are performed only when overlap syndromes are suspected. When there is palpable purpura gastrointestinal symptoms and arthalgia with or without proteinuria or hematuria, the diagnosis of HSP is generally straightforward. In a typical presentation, severe and varied complications recurrences are more common in adults and in younger adults and children or peds in less than 2 years of age. Uh, reduced glomerular filtration rate is linked with a worse long-term renal prognosis. Early identification of impaired renal function is an important part of the biomedical practice and disease progression. And around the disease progression, hematuria is commonly present in HSP nephritis as usually runs a benign basis when isolated. A macroscopic hematuria for more than 7 days in sort of in amongst the sort of literature and evidence have inform that macroscopic hematuria for more than 7 days would require further investigation to explore the differential diagnoses. In the peer-reviewed works, there is a little bit. There's some highlighted information from highlighted information in around the sort of critical microanatomy of HSP. In around the microanatomy of HSP. So where specialists can take into consideration the progression and the prognoses. And in the previous in audio podcast before this one, as part of this series, there's an overview in around sort of some of the microanatomy as part of the microanatomy in around renal pathophysiology and the sort of the sort of the sort of the and sort of the detriment around small blood vessels, small around the small blood vessels linked to progression to the prognoses around HSP. Uh, that draws this audio podcast to a close. This audio podcast has been part of an Interlobular branch edition. This audio podcast as part of a SZtorm Communicade. This audio podcast as part of a Squadron G-Force. This audio podcast as part of a SZtorm Robotics production.